Good evening. My name is Jim Wilson, and I want to welcome you to the final webinar on the science, policy, politics of the COVID-19 pandemic. I'm currently a faculty member at the Perlman School of Medicine at the University of Pennsylvania, but I'm also a proud alum of Albion College. The webinar series that we're concluding tonight was sponsored by the Lisa and James Institute of Medicine at Albion College. Before we get started with this evening conversation, just want to review the format. After our featured speaker makes some introductory comments, I'll introduce 4 students from Albion College who will then lead a discussion with our speaker about the issues that are relevant to the topic. I will also encourage questions from the audience that will come in that part of the Zoom, and try to get your questions out to our speaker. So it's an absolute pleasure to introduce Dr. Debra Joy Pérez. Recently left her Senior Vice President position of Organizational Culture, Inclusion, and Equity at Simmons College to start a consulting business where she's playing a major role in dealing with many of the difficult issues that we're going to be talking about today and helping many organizations. Dr. Pérez earned a bachelor degree in communication from Douglas College and a master's in social science and women's studies from the University of Kent in England, and a master's of public health from Baruch College in New York. And then finally, her doctorate, a Ph.D. in health policy from Harvard University. She has played a major role in dealing with the issues that we're talking about today over several decades, primarily in the nonprofit or philanthropic space, where she developed over a dozen initiatives designed to foster new areas of research in public health, equity-minded solutions, in advancing multidisciplinary research, and expanding various dimensions of diversity. So again, thank you for being here, Dr. Pérez, and look forward to your comments and the Q&A that follows.
Well, thank you so much, Dr. Wilson. I really treasure these opportunities to talk about the work that we are ahead of us as a nation and what each of us can contribute to advance social justice and racial equity in this country. So as Dr. Wilson said, my name is Debra Joy Pérez. I go by she, her, ella. I'm a cisgender, Latina, lesbian, social scientist, scholar, activist. And I'm going to share with you some opening remarks to set the context of what we are seeing nationally regarding COVID and racism and inequities and xenophobia. And I also have, I'm excited to have a conversation with students who will pose their own questions. So as I said to the student discussants, I've spent about 20 years in philanthropy as a vice president of research and evaluation, where my focus was on equity issues. And my background is in public health and racial disparities. In fact, when I got my PhD at Harvard, it was in health policy, and my dissertation was looking at disparities and inequity in mental health among US Latinx populations. And specifically, I was looking at the impact of discrimination on health. And one of the things that we know is that while the coronavirus has devastating effects on people of color and their high levels of stress and mental health, this information and this outcome is not new. In fact, over 20 years ago, Arlene Geronimus, a known scholar at University of Michigan, spoke about the experience high levels of stress mediated on people of color and their health. And this wear and tear was known as weathering because it just kind of beat down the health opportunities of people of color. So today we're hearing a lot of very similar explicit language on the impacts of racism and white supremacy on vulnerable populations, but this is also not new. What's new is that there is a national conversation about that explicit connection. And so how might these feelings and fear and racial anxiety that we're experiencing have on patient outcomes, to say nothing of patient engagement, for example? And among the questions I think the students had was, the impact of racism on clinical trials and participation. So in public health, we've been talking about social determinants of health for decades. And again, as I said, what we're seeing play out in this pandemic is textbook socioeconomic and racial inequality. So we have to ask ourselves, what would it take to create a more inclusive and equitable health environment and scientific environment, so that in this time of COVID, we can get beyond the knowledge of identifying yet again more disparities. When I was at RWJ, Robert Johnson Foundation, one of the most frustrating situations for me as a scholar activist was whenever I would put out a request for proposal, the proposals were about identifying racial and ethnic disparities, and very few were about solving them. Very few were about how to understand and mediate those disparities. So, part of the answer in how we do that is patient engagement, right? Having a better understanding of and patient-centered approach to how the COVID and all of its comorbidities specifically attack and affect communities of color. Like, we have to go deeper, right? And so the truth is that many of these disparities are rooted in inequities, such as high rates of comorbidities among communities of color, making them more susceptible to COVID. Black and Latinx adults are more likely to suffer from obesity, for example, and diabetes than white adults, and asthma is more prevalent among Latinx and African-American adults and children. But it's not just those comorbidities. There is a layer of additional damage done by racism, right? And we need not go very far to think about the kind of vicarious impact of the daily assault on safety. And since May 25th and the killing of George Floyd, we've had a lot of recognition of the toxicity of racism for the entire country. We also have to consider the socioeconomic issues. Low-income people are more likely to have chronic health conditions because of unhealthy home environments, and that's also policy-driven. It's not accidental that the brownfields and the toxic environments are in poor communities, but it's also the economic fragility of many communities of color. How many of those essential workers, right, who are exposed to COVID have been at risk, and how many community members of the community have lost their jobs? So this economic fragility is equally weighing on the impact of disparities. So I just want to share a few statistics, and then I'm going to wrap up and turn it. I know we only have an hour, and I could speak for an hour on this topic because I'm really passionate about it, and I'm looking for change and looking for allies here. But I think it's important to kind of recognize things that we have seen happen since March. And that is, as I mentioned, essential workers, especially those working in cleaning, in grocery, and food service, have been disproportionately impacted. Many without benefits of sick time, many with high exposure rates due to the environment in which they live. And we know from various cities that there's a disproportionate death rate among people of color. Yet there was a lack of data in the early days of COVID. For example, Massachusetts did announce to almost 6 weeks later that they were going to start collecting racial and ethnic data on all confirmed cases of COVID as well as deaths. And so in the early days of that data of COVID, they only knew the racial identity of about 53% of the deaths, right? So everything from xenophobia and its impact during the COVID in the early days, I want to remind folks that, we were hearing things like the China virus, right? So the impact of xenophobia on Asian Americans, the vulnerability of LGBTQ+ students because of, when we sent students home at Simmons University, not all students were sent back to, had home safe environments. And some of them, because of their identities, were in hostile spaces. And so, there was a lot to address during those early days. First generation students who either personally experienced job loss or were living in an environment in which many family members, because they're low income, were losing jobs. So, and just today, I'm sure you've all heard that the administration talked about kind of walking back any national aid to people due to COVID who've lost their jobs. And that will, of course, inevitably have disproportionate impact on communities of color. So again, these aren't new inequities, but it is complicated and by issues of racism and the disproportionate susceptibility of Black and Brown people with regard to COVID. So I will just say that to state the obvious, we are looking at a time in which African Americans who account for, say, a third of positive tests in Michigan represent 40% of the deaths, yet they only make up 14% of the population. In Louisiana, about 70% of the people who have died are Black, though only a third of the state is African American. In Chicago, 30% of the population is Black, and yet they account for 70% of coronavirus cases. So, you could look at almost any city and see that. And this is also true for the Latinx community. Moreover, unemployment, food insecurity, unstable or substandard housing may further perpetuate these inequities. So I hope, Dr. Wilson, that sets the stage for this conversation. I'm really eager to engage with the students on their questions and to get their thoughts on where we are as a nation and the road ahead.
Great. Well, thank you very much, Debra. Very helpful initial comments. And I'm going to go ahead and introduce the students, and then they'll spend their time with you virtually. We'll start with Holly, if you could join us and introduce yourself.
Hello, my name is Holly. I'm currently a freshman at Albion. I'm from St. Louis, Missouri, and I'm in the Gear-Stacker Institute.
Great. Nice to meet you, Holly.
Irene?
Hi, my name is Irene Cronavilla. I am from Atlanta, Georgia, specifically Lawrenceville. I am a biochemistry major, and I'm also in the Lisa Wilson Institute of Health.
Great.
Rosemary?
Hello, my name is Rosemary. I'm from Dallas, Texas. I'm a bio major, junior in Albion, and I am also in the Wilson too.
Great. And Alexa?
Oh, sorry. Hi, my name's Alexa Hitchko. I'm from Chico, California. I'm currently a sophomore at Albion, and I'm a business and Spanish double major, and I'm in the Wilson and Gear-Stacker Institutes.
Great. Well, welcome, students, and I'll pass it over to you guys.
Hi, Dr. Perez. My first question would actually be, so I know you talked about the social injustices in healthcare, but more specifically, what kinds of social injustices in public healthcare policies have you seen so far in the pandemic, such as like health insurance and getting tested for COVID?
Yeah, well, that's a great question, Irene. And what I can tell you is that there have been disparities along the continuum of access, treatment, tests, et cetera. I'll give you a simple example. When COVID first became national news, the focus of the testing was on those who had traveled internationally, right? And those who have traveled internationally are not likely to be essential workers or low-income workers. So the very people that were more exposed were not being tested, right? So it was a missed opportunity. Lots of the, social injustice has to do with infrastructure, right? Who has the ability to go get tested based on their work schedule if they're working? Who has the resources to travel to test? What are the treatments available? Who has access to those treatments? Disproportionately, as you probably know, Latinx communities are underinsured or uninsured. So coverage for testing in the early days, the test was very expensive. And now they're down to about $5 a test. But there was a time when we were talking about $150 a test, right? So anything that has to do with inequality of income, inequality of housing, inequality of education, all of those things impact disparities with regard to COVID.
Thank you.
I think, Rosemary, are you up?
Yes, I'm here to ask you, what significant healthcare disparities have you seen from COVID-19 that have affected Black and Brown racial minorities in the US?
Great. Well, you know, you might recall, and this is probably true in every city, that African Americans and Latinx were going into the emergency room with symptoms of COVID and being turned away and being told, oh, it's the flu, or they don't have access to a test. And in the end, for many of these folks, they were ultimately diagnosed with very little recourse. So the disparities occurred at the testing level, it occurred at the access level. You know, as I said in my opening comments, you know, not everyone has sick days, right? So the opportunity to take care of self without risking, you know, needed income was higher for low-income people. So, you know, disparities is across the spectrum. Even today, we're talking about vaccines, and the question remains, how accessible will those vaccines be, and where will they go first, right? You know, who is likely to have access? Those who have health insurance, those who have resources, right? And those communities that are under-resourced and lack infrastructure, you know, not every community in the country has equal access to 24-hour high-quality healthcare, right? So there are going to be a lot of, you know, kind of travails in trying to make sure that the distribution of the vaccine, once it's identified, is equitably distributed.
So in regards to the SARS-CoV-2 vaccination clinical trials they're having now, noting that the clinical trials voluntarily, how do you encourage all this altruistic volunteering and sustaining public trust after multiple clinical trials failing the public, such as like the Tuskegee trials? What are your thoughts on this? Like, how do you, although it's voluntarily, I know something we're afraid of it, having a monetary incentive and seeking out those low income population.
I really appreciate that question, because trust and distrust have been issues in healthcare for a long time. And you know, you mentioned Tuskegee. Actually, recent evidence shows that when communities of color are invited to participate in clinical trials in their home environment, they are more likely to want to participate. Are less likely to participate if they're being asked to come into the university lab and participate in a test. And we know now from decades of research that, you know, when you go where they are, you meet people where they are in their community, not just in their health center, but in their barbershop, in the bodega, you know, in other places in which trust has already been established. So the study of trust in healthcare has been growing, and importantly, we're discovering that the distrust of the past was actually rational for the reason that you mentioned. You know, it didn't feel safe and to trust the clinical trials or the health system. But today, I think the studies of trust and trustworthiness in healthcare are illustrating that there is more opportunity if the testing and the participation is not in, you know, kind of, you know, distant or non-community spaces, right? So, you know, thinking about, for example, to what extent can nonprofits who are, you know, social service agencies be a place to partner as patient, you know, partners in advancing more participation of underrepresented groups in trials. So, you know, trust is essential to both the physician and the patient. And without trust, you know, how can anyone expect someone to fully rely based on, as you said, the historic discrimination of the past? So there's new evidence, I would say. Most importantly, what I would want students to take home is that as much as we know the damage that was caused by Tuskegee because of its racist intents, that communities of color today are mindful and willing to be part of clinical trials that help their beloved community. And we need to give people of color the same opportunity to participate in trials, to have the necessary evidence that what's being tested has the same benefits to their community.
And like, as we, these trials are running and we're doing preventions to like stop the spread so far, what are your thoughts and opinions on the prevention and aid of COVID-19 established specifically for the people in metropolitan urban areas set by HHS and the CDC?
Yeah, it's interesting that this discourse right now on mask, no mask, is very problematic, and it's become a racialized thing, right? So, we see the conservative right saying the COVID is an exaggeration. We heard that today, that you just have to, be strong and stick through it. Yet we have 200,000 people who have died disproportionately in communities of color. So prevention, and the most important prevention, is wearing a mask, washing your hands. It's going to be some time before we have a vaccine, so those things are critical. So now let's think about, how can we have a positive and strong educational system, right? How do you send kids to school, right? In communities where there aren't resources, right, to and it's for homeschooling, or for, there's another kind of cyber disparities in this, right? Technology disparities in this, right? That are making it difficult for families to protect their children, right? They're being required to go to school a few days a week, right? I mentioned earlier that early research during COVID was talking a lot about the density of urban communities and how you're just by the number of people just more exposed, right? So, right now prevention is wearing a mask and washing your hands, and that's the best that we have. And it doesn't help that there's a lot of misinformation about the value of that. And I think that's where you all as individuals can help communities, your own and others, to educate about what is working. And what we know works 100% is if you wear a mask and you wash your hands.
And then I was also wondering, if we're talking about, the fall of Black and Brown ethnic minorities from COVID, how Indigenous populations have been. So as an advocate for Indigenous peoples and their liberties, how has COVID impacted our Indigenous population? And what are those ways issues are being addressed,
Right.
by you, by the US services, or just by your colleagues?
Yeah, I think that's among the most important questions. Too often, Indigenous populations are kind of that asterisk at the bottom, not enough numbers to include in the results. There's a fabulous book by a woman named Heather Shotton. I don't know if you know who she is, but she wrote a book called Beyond the Asterisk, and it's about Indigenous, kind of the involvement of Indigenous people in higher ed and how they've been excluded from not just higher education, but other fields. So this, we know from Indian country that scholars, researchers, and physicians who are themselves Native American are kind of shining a light on the disparities. And it's as critical, if not more critical, in Indigenous communities, the rate of infection and the issues of comorbidities. I don't think enough, to be honest, Rosemary, is being done, and not enough is being talked about, right? And so I think it's important for you and others who identify as activists to raise that question. What do we know about the impact and the effect of any vaccine on Indigenous populations?
All right. Hi, Dr. Perez. So
Hi.
just kind of transferring to the pandemic on campus and just overall,
Right.
I was wondering what the biggest challenge you have faced during the pandemic has been and how you approached it.
So I think, like all of us, we have family members who have either themselves fallen ill. I've had a family member pass away, elderly in his 80s. I've also had a family member who had a heart attack during the pandemic, and we were unable to be with her in the hospital while she was having quadruple bypass. You know, so it's not, we have to remember that all of this is happening, the pandemic and you know, COVID, in the mix of other health conditions, right? We have, like everyone else, regular family Zoom calls to talk about the impact of COVID in my own family. So there's the physical, you know, health impact. My niece, who's 11, a schoolmate of hers was diagnosed, tested positive. And, you know, I had to talk my sister down from the ceiling because she was horrified. And yet they're required to send their kids to school. And she was worried about, you know, her daughter's siblings. You know, I think for college and universities, the biggest challenge, as I said earlier, was having to send students home and not knowing that not all students were going back to a safe environment, either because, you know, not all of them were welcomed home, for example, particularly those who were queer identity. So we had to figure out where we would house these students while the university was closed. In the case of Simmons, we chose to put them up in a hotel for 3 months because it was the right thing to do. I do think the displacement of students and being home, and particularly, I'm curious about Holly's experience, but when you're a freshman, you expect your first year to be a totally different experience. And I imagine it's what it was for you. And so we had to struggle as a university. How are we making this decision? And are we taking away that kind of, you know, first year experience? And in the end, being in a city like Boston, which is surrounded by 135 colleges and universities with the potential of having, you know, nearly, you know, 500,000 students coming to the state, it was too much of a risk. And so we opted to go completely virtual. And not everyone was well equipped or ready to do virtual. Luckily for the university, it had 7 years experience in already providing online education in its nursing and library programs. But I think that there have been a lot of folks who have had both personal losses and professional, you know. In my family, I've had 3 relatives lose their jobs. One worked in the hotel industry, you know, one worked in the help desk, customer service, you know, and the other worked in the restaurant industry, right? So, you know, I think all of us have experienced some personal attachment to or experience with COVID. And I would say of those, the most challenging was, you know, having someone who passes away from COVID and not being able to have a proper funeral. And that was the toughest part for my sister and her family, was not being able to support, you know, her mother-in-law because her husband had died, you know, from COVID.
Thank you for sharing.
So with trying to going back with the disparities in the Black and Latino populations in regards to COVID, and because most universities and colleges in the nation are virtual, how do you advocate and bring light upon to these issues in a virtual setting? Or like for some campuses like ours, how do you advocate in that way?
Yeah, it's important to have conversations like this. So I would say that if you are in a public policy class, a sociology class, any class that you're in, a chemistry, whatever class you're in, there is a COVID-related experience, right? Like this is the time to be in class talking about, you know, developing vaccines and understanding organic chemistry and what the impact of that might be for different communities of color. I think there's not a single class that you should that you can't bring up the issue of inequity in the current context, in the pandemic, and issues of racism and its impact on the pandemic. I think it's an important conversation to have. If you're part of a student group, it should certainly be on the agenda. What is the activism that you can do as a student group? As I said earlier, the #1 challenge to the current pandemic is misinformation. So how can you as an individual or your organization be a mechanism for correct information about COVID and its consequences and how to stay safe and how to prevent it. So again, I want to go back to the moment in terms of, what we're seeing as a nation with regard to the impact of racism and the incidents surrounding the killing of George Floyd. I mean, just today we heard that there were charges, I want to say Texas, but Rosemary, you'll correct me, or maybe it was St. Louis, of an officer who killed another man who was trying to break up a fight and showed up on the scene and shot the person who was trying to help. So we're seeing, I think, a change in kind of more attention being given to this. So I would invite each of you in your own respective groups, whether you are a person of color or not, or you identify as white, to have these conversations of what it takes to undo racism, right? There's a great article by Kenneth Jones and Tima Oken that talks about the consequences of a culture in which white supremacy characteristics thrive, right? So, and the consequences of that and how that shows up in organizations, in predominantly white institutions and organizations. And I think if anyone ever want to learn anything about racial justice, this is the time to do it. There isn't, a lack of information. There are podcasts, there are, news articles, research publications, all on the issues of race. I would recommend How to Be an Anti-Racist. If you haven't already read it, by Kendi. I would recommend White Fragility by Robin DiAngelo. I would recommend Waking Up White by Debbie Irvin. Debbie Irvin actually has a 21-day challenge on kind of raising consciousness about privilege that I think it's an important tool and exercise. So I think now is the time to bring it up in every space you're in, and you might just ask the question very simply, how does race operate here? How is racism operating here? How is privilege operating here? How is power operating here? And then the second question you ask is, what would it take to undo it?
One question before we move on with the students related to something that came up earlier, which was, the statistics on how the underserved are disproportionately affected by COVID are stunning.
Yeah.
And actually, this is being communicated in the press.
Mm-hmm.
And it seems that the systemic problem may be highlighted by COVID.
Yeah.
Do you see, how do you see that playing out?
No, I think I'm so glad you mentioned that, James, because the truth is, as I said before, these disparities have been around for decades, right? And I think it's the recognition. This is the opportunity that this moment presents. It's the recognition that we're all connected, right? That if you do not, take care of everyone, we are all in worse health, right? So I think that's one reason. Like, there's a recognition that we have to do better for everyone in order to get, to really beat this thing. And I do think that the combination of the national urgency around and the reckoning of race, kind of the racial reckoning, in alignment with the national and global pandemic, has given it more premise, more focus, and more importance. I mean, to your point, there was an article today about the disproportionate socioeconomic impact of the pandemic on communities of color, right? No surprise there, right? But these things are important to discuss. And I would agree with you that even these disparities and inequities have existed, this time, the recognition that we are all interconnected, and unless we can address, the famous MLK quote, injustice anywhere is injustice everywhere, right? And so that recognition that we are interdependent is crucial, right? And that we can actually do something about it. So I want to make sure that before 8 o'clock rolls around, that we have a chance to acknowledge the power that we have individually in this moment, that there is, for me anyway, I feel a sense of hope and optimism to address some of the racial inequities that I've never felt before. I mean, I don't think there's been a time in my career in which white people have talked openly about white supremacy, right? I mean, in the past, when people would say when non-people of color would talk about identity, it's almost like they would whisper white, like now it's like people are acknowledging that the skin they're in is affording them privilege, and they're seeing that, right? And I have to say, even for me, I mean, we're all on this growth and the growing edge journey of equity. And for me, as an LGBT, Latina, et cetera, for me, the privilege that I hold is able. I'm able-bodied. I don't need to worry about how I get into a building. And so I think this moment is forcing us all to acknowledge our own privilege. I also recognize that as a Latina, I'm light-skinned. I'm not an Afro-Latina, right? The experience of being Afro-Latina is different, right? So I think there's also that openness now to really, do we really want to be a nation that's so divided and just full of pain, or do we want to be a nation that embraces the strength of our diversity?
It's just one other comment about that. Thinking about this on global terms, how we're all interconnected. I work in vaccine research, and about 10 years ago, I met with Bill Gates, who was interested in what we're doing, and he said at the time what he worries most about is a pandemic. This was 10 years ago. And I asked him why, and he said, in developed countries, there'll probably be resources, but this globe is not safe until we deal with developing countries.
Yeah.
Because we're all interconnected.
Right. I mean, I was listening to NPR today, and they were talking about the price of the vaccine, and could developed countries afford the vaccine? And the commentator said, it's not a question. It's like, we have to make sure that everyone has access to the vaccine, because it won't work otherwise, right? So this interconnection is really important to the kind of the global public health, right?
Right, yeah, great. All right, I think we'll go back to the students. Holly, I think you have another question.
Switching the topic kind of to more of your professional life, I have a question of what plans do you have to enforce diversity, equity, and inclusion at Simmons University?
So I'm no longer there, but I left a very strong team behind. And right now I will say, if you go to the Simmons website, you will see a lot of resources that I helped develop on anti-racism, there's a whole list of resources for how to be an ally. What does allyship look like? I think that acknowledging, for example, I'm not sure, Jim, where your Albion is on this, but, faculty of color need a space of their own. Students of color need a space of their own, but creating spaces where those conversations can happen, and at the same time, building the muscle of allyship among white students, white faculty, and white staff, right? Because again, as I said, all of us are on this journey, and it's going to take everyone. So it's not just the people of color's job to undo racism, right? White folks are a part of this because, frankly, and I believe this in my heart, that they are losing just as much by living in a racist world as in terms of their own ability to connect and to benefit from the richness of diversity and culture. So there's loss there. And I think if I had to pick a challenge, to me, that would be one that I think we have to work towards. So, and I will, pivot perhaps to another issue that's been really important to me, is like, how do we get beyond calling people out and versus calling people in? When we call people out to shame and blame and, guilt or humiliate them, we don't necessarily gain, we don't move forward in our progress, right? So what we need to do is call people in to self-reflect. And that means having people, white people particularly, understand the cost of emotional labor, having them do their own work, but not to kind of, browbeat and shame and humiliate people so they're not engaged in this conversation. So to me, you need both the internal work right? And you need to do that work externally.
So we have about 20 minutes left. And I think the students were really interested to learn more about your career and
Sure.
and leadership. So I'll pass it over to the students, a series of questions for the rest of the hour. Holly, I think it's you. I think Holly, yeah, there you go.
Okay. I was wondering, what skills do you think are needed to be a great leader?
Yeah, so I think that's a great question. And I would say I do a lot of mentoring. I worked very closely with an organization called National Urban Fellows, which is the program to increase the number of white women and people of color in public policy and public leadership. And I often say to my mentees that if you are the smartest person in the room, you're in the wrong room, right? So figuring out ways in which you can expose yourself to people who think differently from you, who have different perspectives from you, from whom you can learn, right? I think that's really important. I think cultural humility is important. I don't know what it's like to walk in a white woman's shoes, and I have to, in order for me to connect and be in relationship, I think I have to create a space for those kinds of conversations, right? Without, again, as I said, shaming and blaming. I think leadership requires, I always tell people that the best thing about having power is giving it away. Like, how do you identify the person who has the softest voice in the room and creating space for them, right? So it's not, there's another great proverb that says, go fast, go alone. Go far, go with others, right? So if you want to make change, it's about going far, right? And then I have a lot of education. Certainly that helped. I think part of it, to be honest, was my own imposter syndrome, not ever feeling smart enough or good enough. So, after I got my bachelor's degree, I went to Europe, never having left New Jersey, just went to, applied for and got into the University of Kent in Canterbury, England, and went to Canterbury and got my master's. And then I went down, lived in Spain for 7 years. I traveled the world. I came back, did another master's, and then ultimately did my Ph.D. at Harvard. And a lot of it was driven by, am I ever going to be enough? Am I ever going to know enough? So I have to deal with those kind of little voices in my head still, even as I, to many accomplished in my career. I'm very grateful for that. But, I think there's part of that drive in terms of leadership skills was about, how if my role, I really believe in social justice and equity, and I want to be as able and capable in that work. So I do a lot of, reading, and I'd say, to be honest, maybe I should have started out with this, listening and learning.
Throughout, I guess, your career and just leadership opportunities in general, what would you say has been the most important lesson that you've learned?
Yeah, thank you. I mean, so I participated in a number of fellowship opportunities. I was a Kellogg Scholar from the Kellogg Foundation. I got my Ph.D. through them. I was a National Urban Fellow. I got my master's with National Urban Fellows. I've been a part of a Latino sorority. I think these, I'm a big believer in network. Your net worth is your network. So a lot of what I do is networking, and I like the cohort experience personally. Not everyone likes the cohort experience, but I like going through kind of leadership opportunities or programs with other people. So I think I'd have to say that going to a women's college, I went to Douglas College and at Rutgers University, was impactful. And being a part of these different fellowship programs that really kind of made me who I am.
What challenges have you faced in your professional career, and how did you overcome them?
Yeah, I guess the one I would say is the one I mentioned earlier. I struggle with imposter syndrome. So my mother has a second grade education, or had. She's passed away, so has my dad. He had a third grade education. It wasn't until my high school guidance counselor, Mrs. Garces, when I was in 10th grade who said to me that I was smart and that I could go to college. And then no one in my family had ever gone to college. And I'll tell a quick story that I remember the day where she handed me this college application to Rutgers University and Douglas College. And she asked me to, go home and have it filled out. And I did. And I noticed that in the application, it said it must be submitted with a $25 application fee. And we grew up poor. I mean, my family, we grew up on public assistance, and there were 9 kids and my grandparents. So $25 back then was a lot of money. So I didn't even bother asking my mom and dad. And I just told Mrs. Garces the next day, I'm sorry, I can't go. I don't have $25. And Mrs. Garces reached into her purse and she wrote a check for $25. And that led to my being able to go, apply to Douglas College. Of course, going to school costs a lot more than the $25 application fee, but there was something about that gift and that investment that she made in me, that belief. In fact, subsequently, I wrote an op-ed piece for my local newspaper called The Gift of Encouragement, right? I felt seen and that she believed in me. And in this article, I tell the story that I just told you, that I went on to go to Douglas, I got my MPA, I went to Europe, I lived in several countries, and I was finishing my Ph.D. at Harvard at the time when I was writing this op-ed. And the best part of the story is that Mrs. Garces, who had given me the $25, read the op-ed piece in the newspaper, and she contacted them, and they gave her my phone number, and we had dinner. And I was able to say thank you, right? Because she believed in me and she invested this $25. And so, for me, a personal challenge is how do I give back the way she gave, what she gave to me. And I always believe, as you move forward, you've got to bring people from behind, right? That you never underestimate the power of a kind word, or a quick motivation. Not for nothing, but I got an email like two days ago. I'm going to look for it because it really moved me. And it was actually a LinkedIn message from a student who was part of a leadership she was part of what's the name of the program. She was a McNair scholar. I'm not sure how are people familiar with McNair. It's Ronald McNair was an astronaut, and there's a program to support underrepresented scientists. And she sent me this message, and it was in 2017. I'm just going to read it because it's to me it was like that makes this point. Like, we met about 3 years ago in 2017 at the University of North Texas McNair conference, where you were the keynote. At the time, you went to my presentation about Korean to Spanish translation of emotion, and you seemed genuinely interested in my project. I remember that vividly because of how excited you seemed about my project, and I wanted to thank you for that. At the time, I was struggling with a few things, including my project, but part of the reason I felt renewed interest was because someone was just as excited as I was. After graduating from my undergrad, I decided to finish a master's in Korean studies on the way the LGBTQ communities is represented in Korean media. So again, I just wanted to say thank you. And although you might not remember me, your words of excitement for my project is something I will never forget. I mean, I that came out of the blue, like 3 days ago. I had that conversation in 2017. And to me, that makes my day. I mean, I'm just like, anytime and I think that, in honor of my parents who had a second and third grade education, right? Like, anything I can do to support the next generation of scholars and give people who don't have much, kind of that hope and, aspiration to pursue their dream, I'm all for that. So let me go back to the story Mrs. Garces. Subsequent to that conversation and that dinner, of course, she was in her 80s and she's long passed away. And because it was a $25 application fee, I started a personal donor advice fund called the $25 Fund in honor of Mrs. Garces. And every year I give 4 scholarships from the high school I went to in Trenton, New Jersey, in her name.
What accomplishment would you say that you're most proud of?
You know, I have to say, my family teases me a lot because, you know, I'm the person with the most education, and they kept, you know, saying, when are you going to stop? And I think, you know, when I got my PhD and I got to wear that floppy hat, you know, and I was walking, you know, into the ceremony, to me, that was like the culmination of many things. Like, I could never have imagined, as a poor kid growing up in Trenton, New Jersey, and then, you know, struggling with my sexual identity and having all of these issues as I was growing up, that I would be walking, you know, in commencement to get my PhD from Harvard University. I mean, that was like, that just blew my mind, you know, and I think that's the thing I'm proudest of. And then I think, you know, related to that is that has opened many doors for me that allows me to provide opportunity for others. So I would say the second thing I'm most proud of is my mentoring and the people I have mentored throughout the years.
I think we're coming to the end, Debra, but what an incredible time. And to hear your story, it's almost a moment in time, in some ways. Very, very concerning, but maybe there is opportunity and light. And in your words today, you mentioned allies. I'm sure you got a lot of allies. You didn't. I'm sure you gained a lot more through this hour. I hope. And I'll give you the last word then before we close the webinar series.
Yeah, I'll just say that, and for anyone who needs to hear this on the call, that you're exactly where you're supposed to be. That you are divinely guided to make a difference in the world, and you're being a part of Albion, and you're being a part of the program that you're in is part of the difference that you're going to make. And to the extent that you continue to feel like, if ever you feel like you're not seen or heard, you have one more person in me that you can call and email and talk to. I'm sure that Dr. Wilson is also there to support you. And I would also say that it's quite normal to feel lost sometimes, that, you know, we all go through that. We all find, you know, difficulty in our lives. And I think if you kind of can reflect back on your why, like I always talk about, you know, there's a great talk by Simon Sinek on the TED series, and he talks about what he called the golden circle. And he said, too often we talk about, you know, what we do. The first thing that people ask you, particularly in this country, is what do you do? What do you do? Right? Very few people talk about the how they do what they do. And almost no one talks about the why. And it's important to talk about what motivates you. What is that? For me, it's my family. The fact that I have 6 sisters, 2 brothers, 33 nieces and nephews, the most recent who's 5 months, and my oldest niece is 40. Big, like I've got, you know, 33 nieces and nephews who I want to make sure live in a better world, right? So that's my why. You know, I profoundly believe that, you know, that I'm here on purpose. And, you know, George Bernard Shaw used to say that his life, this great quote about community, that he wants to give, you know, all of his life to community. He wants the candle to burn on both ends, because when he passes, he wants to make sure that there's light for others to follow. So I want to be thoroughly used up when I die. And I will just say that I think we all, whatever that purpose is for you, it is valid. You're valid. What you dream about is completely possible. And I applaud you for doing what you're doing.
Great. All right. Well, thank you again, Debra, and thank you, Albion students, and not only for this webinar, but the previous ones, and your participation was inspiring. And I'm sure as a community at Albion, this is, in the lessons we learned through this webinar, including Debra's comments, is going to be with us for a long time. And in fact, it will be on YouTube. So anyone else that wants to see it will, and I'm sure there'll be many downloads. So again, everyone be well. Have a great evening. Take care.
Thank you.
Thanks again, Debra.
Bye-bye, everyone. Good luck.
Okay.
Stay well, stay healthy.